if something happens to that child, and we are talking of pre-existing condition, which in our last video we talked of pre-existing conditions,
yes.
being conditions you could be having prior to having or taking a medical card or medical cover, and this could be maybe cancer or something like that.
Yes. Hi everyone, I hope this video finds you well. My name is Martin, in case you're here for the first time. Na sisi ni watu wa insurance. We do civic education as well as reviews on insurance, especially within the Kenyan market. We have been responding to your questions, and in today's video is not exemptional. We are doing exactly that. So kama uko na swali, we are having a week or two ya kuanza mambo ya medical covers. Now in today's video we just want to respond to one of you who was asking a question in regards to medical covers for children. So kama uko hapa uko na swali, do not hesitate to send that question, especially in the comment section. We are picking those questions and we will be able to respond to you in a detailed video such as this one in the next one. So usikwame hapo ununue medical cover lakini hujauliza maswali. Uliza maswali iwezekanavyo ndio you avoid being frustrated. The reason why most people are frustrated is not because insurance is bad, but it's because you are not informed. Hujui, you are making blunders wewe mwenyewe because of lack of information. So we have always had this conversation with my guest, na nitarudi kumuita mwenyeji, sio guest anymore, because he's doing a very good job in explaining to us and helping us understand matters insurance. So this is a client alikuwa nauliza, is there a medical cover specifically designed for children without involving parents or guardian? If yes, which are the options in the market? So hataki, maybe we have, like, let me give you an example. A grandparent who want maybe to buy for a grandson or granddaughter, lakini hataki kununulia wazazi, anataka kupea gift kwa mtoto. So kunakuwa na hiyo cover specifically ya mtoto without involving parents. So that is exactly what we are looking for today. We are having that discussion today. Take a pen and a paper and we are about to learn. So karibu sana Bwana Mwai.
Thank you.
Yes.
Good. Again, to our viewers, I really want to appreciate you for the continued support. And today, or let me call it tonight. Do I call it tonight?
Yes, for those who will be watching at night.
All right. So we have this particular client,
Yes.
Or let us call him a viewer.
Yes.
Who really want to understand whether if you can buy a medical cover for only your junior.
Yes.
Because we have scenarios where you could be having one or two families
Yes.
outside your main one, and you want to still buy medical cover for your children when wako kwa boma ingine.
Yes.
Ama huyo guka anataka kupeana ka gift kwa grandson. So to answer your question,
yes,
let me answer it to the affirmative and tell you, yes, it is very much possible to have a cover, medical cover, only for the juniors or for the kids who are below 18 years. So, however, I must tell you that we don't have a lot of options in the market. Currently, I think we have only two, which we can discuss further, because here we are not discussing a particular company. And let me show you the difference between the normal, the ordinary, or what you call the standard medical cover and the junior medical cover. So what you'll understand about this junior cover, right? Junior medical cover and senior. We have senior medical cover. We basically have three types of covers. We have the junior, we have the senior, and we have the standard. So for junior, any person who is below 18 years and below. Any person who is above 65, above 65 years,
above 65 years,
that is what we call senior. And then we have standard. those who are between
18 and 65.
18 and 65 years. These are different medical covers structured to suit them based on their needs. For example, a medical cover of a junior and a senior, you must expect it to be quite similar because of these two things. One, their immunity, both of them are quite not that good. It's quite weak, their immunity, so they may require things like supplements, other medicines that are made or designed to help strengthen the immunity.
So in short, chances zao za kwenda hospitali
ziko juu. And for the standard hii ya mtu wa kawaida mwenye ako between this age 18 up to 65, this one even in terms of how much you would pay, it's relatively cheaper compared to junior and senior. So this is the curve. Let me say this. For people who are here 18 and below, you expect that their medical is quite high. So as they mature, their medical cover is like this. It goes like this, and then at the peak inarudi huku juu. So this is for junior. Inaanza.
This is for junior, this is for senior,
yes.
This is for standard.
This is for junior. This is for the senior here. I mean standard. Standard. And this is for tunaona mpaka seniors and junior and seniors. It's almost the same amount.
Yes.
Yeah, because of those medicines, they are quite expensive and they are special.
And chances of using
and the chances of them going to the hospital is quite high. So basically that is what we have. But we can do a simple quotation here so that our people can understand. And we give me an example or a case. Let's assume we have a child here who is 8 years.
Yes.
We have a child who is 8 years old. That is 08. So a child who is 8 years. And this child requires what? He requires, of course, inpatient. One thing I must inform our viewers is that you can't take outpatient
alone.
You must take it as a combination if at all you want an outpatient.
But you can take inpatient as
but you are allowed to take an inpatient cover alone. Now we also have a outpatient. We have a dental, and we have optical. So these are the options. What we've agreed is that you are allowed to take inpatient alone, but if you want to take either dental, optical, or outpatient, you must combine it with
an inpatient. Yes.
Again, you cannot take dental alone without taking outpatient.
Yes.
So it's a combination. So this is a 8-year kid, and he want a medical cover.
Yes.
I want you to help me do this quotation. So we have a 8-year-old child who want a medical cover, or whose guardians want to have them
covered without
the parents.
Yes.
So it is very, very simple. So we shall just come here. We say we give him a cover of 1 million. Or 1 million. 1 million. And we give them outpatient of how much? Let's say 50,000.
Okay, 50,000.
50,000. We do dental of. Do they need
20.
dental? Yeah.
Let's do 20.
An 8-year-old may really require a dental.
Yes.
So we do 10,000, and this is dental. This is outpatient. This is inpatient. IP, OP, dental.
Optical,
we do
10,000.
Optical of 10,000 also. This is optical. So this is how much we shall charge. It's very, very simple.
And this is just a sample of what is in the market.
Yes.
There are other options.
There are other options. So let's assume the kid is called John. John, maybe John Otieno. Otieno. Yeah, and parents, let's just take Adame. Adame, gmail.com. Yeah. Yeah, we are talking of this. So yeah.
Date of birth, you can give maybe.
Sorry. Let me do it again. Let me redo it. This is new quotation. We want a junior, a Milele junior.
Yes.
Because we have a specific cover for them. And we've talked of this being John Otieno.
That's good, huh? Just let me.
Yeah, this is Adame. With John at Gmail. Good. So you can see all this benefit you've said, that inpatient should be $1 million, outpatient of 50,000. Yeah, a dental of 10, optical of 10. So that's it. Yeah, we also need outpatient of 50. We also need inpatient of 50. I mean, no, dental of 50.
Dental of 10.
10, yes.
And optical.
Yeah,
10.
so the much we are supposed to pay per year, by the way, guess how much? It's just 53,000. 53,682. That is the much we need. So 53,000, yeah, 682.
Yes.
For all these covers.
Okay.
So what you'll note is that the difference between junior and the standard, the difference could be maybe 1,000 or 2,000.
Yes.
The standard could be cheaper by
2,000
or somewhere there. However, we can opt to have what we call the most premium medical cover. Yeah, this cover, this premium cover, or the most, do I call it the most advanced? The most advanced is this one. You can opt to pay this 74,554. But the beauty about you having this one is that it doesn't have what we call the sublimit. If something happens to that child, and we are talking of pre-existing condition, which in our last video we talked of pre-existing conditions,
yes.
being conditions you could be having prior to having or taking a medical card or medical cover, and this could be maybe cancer or something like that.
Yes.
So in the event of such ailment cropping up later, there is no limitation. Because for example, if the cover is 1 million, the card ikona inpatient ya million, and you take this one, pia itashughulikia medical expenses za 1 million. But kama uko hapa, kama umechukua hii ya 53,000, because they are divided into clusters or ni kulingana na affordability. Hii tunaita just a standard medical cover. But kuna ingine ya hospitali zenye ziko juu. Hii ndio unachukulia kama uko na mtoto mwenye maybe unaona in focus, because it happens sometimes. You could be having a kid who has already an existing condition. Unamchukulia hii, unaongeza maybe 10 or 20,000. But if there is a pre-existing condition or another condition comes up, what we call the chronic or critical, ita cover to the full limit. But hii itakulimit, itakwambia ina cover 10%. That is, a cover of 1 million will only cover
100K.
100,000. So instead, why don't you just take this one? So we have different sub-limits.
So I think the difference is just, is it 21?
21,000. Yes. So that is why we keep on telling you the best or the easiest way to handle these matters of insurance. You need someone who have the understanding and can expound more. What is the difference between having a medical cover in insurance A and having a medical, because they are all different. I will be very, very open.
Yes.
They are very, very different. So you need someone who can advise you accordingly, so that you don't make a mistake, because for medical si kitu ya kugambo nayo. Ukishachukua umechukua until mwaka ishe. That is the only time you can change, because you can also choose when ilifanya mistake ni uchukue another insurance company. But when something happens and you are now in the hospital, you are not allowed to use 2 cards. You must note that. Because lazima hii ikuwe exhausted ndio hii ichukue. Otherwise, if you give out both cards, they may come together. Wanasema we are cost sharing.
Because we mentioned this, I think, in a previous video.
Yes.
That the purpose of insurance is not to enrich you.
Yeah, sio ya profit. Wewe unachukua kwa sababu unataka usirudi kwa mfuko.
Usirudi kwa mfuko.
Yes.
So hata ukichukua insurance mbili kwa the same child,
yes,
ama the same patient, hawezi tumia ati kutengeneza pesa.
Hapana. And what you can only do is that you can choose which insurance unataka hii simamie. Yes, you can have two, but unaweza choose useme nataka company A this time isimamie, maybe next time. Yes, that is the only advantage.
So hata ukichukua mbili ukienda pale kwa hospitali, kadi ni moja.
Kadi ni moja, hawezi tumia mbili. Not unless the medical nini imekuwa too high. So unaweza sema niko na ingine hapa, sitarudi.
Once you exhaust card A.
Yes, once you exhaust the card A.
Okay.
Yes.
Wow.
You having a medical cover is way better than not having one. Yes. And especially for the juniors, because if you compare how much you are giving out versus the value you're getting, you may not really compare.
Yes.
Yeah, head to head. Because for a cover of 1 million, 50,000, outpatient 10,000, dental, optical 10,000. Yeah, but this one, easy as outpatient, you can choose to have a higher limit. Yeah, because sometimes you unaweza pata katoto kanataka ile tunaitanga nini braces. Yeah, it may not really cost 10,000. You can go way.
There are other limits,
limits zingine, but that is why we are here.
Yes,
to always guide you.
Wow.
Yes,
I don't think there's anything to add. You have really explained so well, so I think we have covered most.
Yes.
Maybe if you have another question that you feel was not answered in this video, let us know in the comment section, so that we do another video. We want to educate you as much as we can, ndio at least mununue cover mukielewa what you're getting yourself into.
Yes.
And definitely insurance is good, but lack of information sometimes can lead to frustration.
Yeah, sure.
That's why we are here to educate you guys. So thank you very much for watching this video to the end, and I hope to see you in the next one. Until we see you then, is a God bless you and bye bye.
Thank you so much.